Yo. All right. Well, welcome everyone. This is Jeff here, and I have a very special guest on with me today from Clearwater Benefits. I have Mr. Thad Puckett, who's going to talk to us today about healthcare for real estate agents, which if you're a real estate agent, you're watching this right now, or you're on our show, you're obviously in a place where health insurance is extremely important, especially right now. It's not something that's openly offered to us as independent contractors, as it would be if we were a W-2 employee working from an employer. So we're going to spend some time with Thad today. We'll ask some questions. We'll have him go over some plans. And I know you have a lot of great stuff to share with us. So thanks for being on here today, Thad.
Well, Jeff, thanks for giving me the opportunity. I'm excited always to have a chance to speak to realtors. I don't feel like I am one, but I feel like I understand what you guys do. I've spoken, gosh, probably to 1,000 different realtors since the beginning of November, different calls. And it's been a good experience across the board to be able to just kind of get a sense of the world that you guys live in. You're right. As a 1099 employee rather than a W-2 employee, it puts you in a different circumstance and a different set of kind of options available for health plans. And Clearwater was found last year by eXp, and we've continued to. I think the attraction was just the willingness on our part to be creative and to be innovative, which aligns really well with eXp as a company. And we've continued to iterate and continue to be innovative and found even better options than when you and I spoke last November.
Right. So why don't we'll get started with, what is Clearwater Benefits? How does this insurance work for, not just for real estate agents, but how does it differ from what we as a society and a culture know as getting health insurance? How does it change and then we'll talk about some of the benefits.
Sure. We Clearwater Benefits is a company based out of Austin, Texas, launched about 2 years ago. We have a great team of people who've been involved in health plans of one type or another. We're a full service insurance brokerage. We do service group. We represent to those W-2 employers a set of options and an approach that is just a little bit different. One of the problems in healthcare in America is the constituencies, the incumbents really aren't really motivated towards change. And yet everybody in America realizes that health plans, health insurance especially, is kind of a broken system in a lot of ways. Yeah. And so what I was not a part of the founding team, but launched personally with Clearwater last August, and have loved the opportunity. We're a virtual team too, just like you are, just like eXp is. And so we really understand the nature of working together collaboratively, but at a distance. And that was true even before social distancing became a part of our lexicon, right? We didn't even know the term then, but we all have been doing it. At any rate, we're full service insurance brokerage. We do work with groups across the nation. Our philosophy is that we need to work on your side of the table, whether you are an individual as realtors or as a group. Nonprofits is kind of my background and specialty, but we also work with other kinds of employers that range from construction firms to just trying to think, medical entities, direct primary care facilities, you just name it, we do it. And it's not only health that we represent. In fact, you're going to be seeing this. I'll give you a sneak preview of where we're going for eXp agents, and that is to extend our offerings towards life insurance and helping you guys to find really quality plans that are of benefit to you. I apologize if you hear my dogs barking in the background. My wife works at home too, and they seem to be quieter for her than whenever I get on this thing.
I get it. I have kids. I have dogs. It's funny, actually. You can see I'm in my new office. My office prior to Just a few days ago consisted of my kitchen table, my living room table, sometimes out on my back porch, sometimes
Yeah,
my front porch. I do a lot of walking around while I'm on the phone, but now that everybody's been home, which is great, so consistently, it's great having them around. My family was kind enough to redo our extra bedroom. It's all freshly painted. You can
cool.
see my wife put a plant in here for me. So I've been able to get to, but I understand that with the dogs barking and especially working in a virtual world, I teach a lot of classes. There's always something going on. So
Yeah,
we get it, Dad. No worries on that.
cool.
Yeah. So tell me a little bit about how, let's say I'm a real estate agent, I'm an independent contractor, and I need to go out and shop insurance. The first thing I think of is, okay, well, what do I see on TV? I see Blue Cross Blue Shield, I see Anthem, I see these commercials for insurance. So I start calling these insurance companies and I start getting quotes and I start getting information. But as you well know, from the consumer standpoint, it's very confusing. There's a lot of different options, a lot of different plans, a lot of different deductibles, and finding the right one can always be a challenge. How does Clearwater differentiate itself from, let's say, the major insurance carriers out there? I know you're a new company, 2 years. I mean, you look at like Blue Cross Blue Shield; they've been around for probably 100 years. So how does your company? What's the difference? What's the difference, and how are you guys unique and able to provide what you're going to show us later?
You're right. It is a difficult world for independent contractors. There are plethora of options available, but they really change depending on the season we're in. And I'm not talking about winter, spring, summer, and fall. I'm talking about open enrollment, in the community or the nation as a whole. And the reason for that is, as a 1099 employee, you're in the individual insurance market if you're looking at a traditional approach. Um, and the cause of that is the Affordable Care Act says that the only time individuals, with few exceptions, the only time individuals can actually purchase a traditional insurance product is going to be from November, typically the beginning of November through the middle of December. There are some states, California is one of those, that this year extended their open enrollment season through the end of January. So we were still having conversations with people from eXp at as late as, January 30th, agents that were in California. But when you get out of that season, unless you have a life change that is a qualifying event, you're not going to be able to purchase insurance in the traditional vein from the traditional carriers. And the reason for that is because of the Affordable Care Act's requirements. You'll be aware, you've already referenced it, that your relationship with eXp is different. It's as a 1099 rather than a W-2 employee. The challenge that then puts you in is you're just in the individual marketplace. And that marketplace is only open to you from November through pretty much the middle of December. We have at our disposal at Clearwater during the appropriate season or the appropriate opportunity, if you have a life change, and I'll go through those in just a moment. But we have all of the available resources for the marketplace plans. And the truth is, Jeff, one of the conversations, I don't think I had it with you, but I did with other realtors back in November and in December, early December especially, was the fact, part of the conversation is what's your budget look like? Some of you guys are just getting started in your careers as realtors. And with that comes a lower income stream. It hasn't developed yet. I won't forget about the second week, around the 10th of November, having a conversation with a couple both of whom were eXp realtors, and they were telling me about their own experience with the marketplace. And it wasn't just that it was confusing; it required them effectively to be like an accountant, because what had occurred when they launched their career in real estate was, as many would have, they don't have any income at first, right? And so they qualified for a subsidy from healthcare.gov, from the federal exchanges. And what they lost sight of in the second year was that their incomes had gone up. And when it got to the third year, they were completely caught unawares when the government said to them, we're going to want $36,000 back from you.
Oh, wow.
Because their incomes had gone up, and it will vary from state to state. Roughly, an individual who makes more than 50,000 or more with as one person in the household, they're going to no longer qualify for a full subsidy, and they lose it incrementally, but depending on how much they make. And a family of four, if you make more than 80,000, and it varies from region to region as to what the exact dollar values are and what the actual subsidies would be. But I was working with people back in that period of time, back in November, December, to help them find what would fit their budget, right, when they're just getting started in their career. The problem becomes for the high earner, for those of you who have been successful at real estate and have made a great deal of money, and your incomes have gone up in a calendar year, and you stop qualifying for the subsidy. Suddenly, even when it's available to you in the marketplace with the traditional insurance approach, it's quite expensive, hugely expensive, in fact. That may be your experience.
Yeah, I didn't know that. So the as an independent contractor, the insurances that we would normally be quoted are you saying on a rolling scale? So the more money we're making, the more money we're paying the insurance company?
Well, it's really it's not so much because you're an independent contractor, it's because you're just in the individual insurance marketplace.
Individual insurance market. Okay, that's right.
That's
Versus
right.
being part of a plan through an employer, which of course is a larger group plan, right?
Yeah, and there's challenges across the nation for 1099s that make what your specific career field the maybe the most challenging, and certainly the largest of the kind of underrepresented groups in America for really quality plans at affordable rates. And that's because you're all 1099 employees.
Mm-hmm.
And as 1099 employees, the employer has some restrictions about the ability to actually put, maybe we get Wes, the lawyer, to speak about this unless it's not his area, but they cannot make a contribution to an employer as an employer sponsored plan. So even when we're talking today about these plans, while we represent and we work for eXp agents, there's not an employer sponsorship in terms of money on the table as a part of these plans. So it's all for you as the independent contractor, independent realtor, to actually pay the cost. So, but that presents part of that conundrum that you just addressed early on. Depending on the time of the year for you as an independent contractor, that marketplace, the individual marketplace, isn't even open unless you have something like a qualifying event. What would those be? The birth of a child, the death of a family member can be a qualifying event. The loss of an employer-sponsored health plan. Now, that doesn't happen much, and actually it's probably not going to happen at all during the current season we're at with COVID, unless the company just goes bankrupt or you get laid off or something of that nature. But those qualifying events for W-2 employees, or rather for individuals in the marketplace, are the only things that will open up traditional insurance to you, the Blue Crosses, the Anthems, the Humanas, Ambetter, whoever's available in your region. Those are only available outside of the open enrollment season when you have that qualifying event. So, and that doesn't even get to the complexity of what the plans actually look like, does it?
Right. Yeah, exactly. Well, that gives us a good overview of kind of the health insurance market and how that works. Like we said, we'll keep going back to the W-2 employee. You know, you show up for work, you get your benefits package plan. They show you, hey, you have health insurance, and great, I'm all set, until we actually need to use it. And then when we start to use it, we start to realize what the deductibles are, what's not covered, what is covered. Next thing you know, we're getting bills in the mail. We don't understand it. Got to call an 800 number. You talk to somebody different every single time. It becomes very, very confusing. And I know for a lot of people, very frustrating. And especially as like you said, in the independent piece of things, makes it even more difficult because we have to go out on our own and find these things. And I know a lot of real estate agents, such as one that we talked to earlier, doesn't have health insurance, you know, and even though we're all supposed to, we're all required to have that, there's still people that don't. And a lot of it is because of that confusion. So can you take a couple minutes and show us maybe some of the plans, how Clearwater works specifically? Because I know people are going to want to say, all right, this all sounds great, but how does this work? Because there's a sharing component as well that is really in alignment with how eXp works. Maybe you could go over that differentiation between standard health insurance and what Clearwater's doing, and then go over
Absolutely.
plans. That'd be great.
And the thing that is most interesting, Jeff, is that we've actually just launched upgraded plans. We actually are working with different sharing partners. And what we've done is we've made the experience better and more easier to use with no friction, but still combines all of the component pieces that we addressed back in November. Let me go through them. I'm
Let's
sharing my screen. I may have gone through a similar kind of document when you and I spoke last fall, but it flows a little bit better at this point. We still have two types of broad swim lanes, standard and premier. Last year, Jeff, when we spoke, we may have talked about gold and silver. We changed the nomenclature. Standard is silver, gold is now called premier. I typically will start with people talking about the premier levels, because if you're in the traditional insurance marketplace, you're able to save so much money with our plans. Why not put those those saved dollars to different uses? And what these include, we're going to talk about at the very last row here on this screen. So virtual primary care, teledoc. All of our plans include teledoc. All of our plans are going to include preventative care. Those are annual exams.
Dad? Just real briefly, what's teledoc?
Certainly. Teledoc is telemedicine, telehealth. In fact, it was the fastest growing part of American healthcare prior to COVID-19 showing up on our doorsteps. Right. And now everyone, in fact, I may have used this very line with you back in November. Teledoc is a great way, having a teleconference, either a video conference like what we're doing right now, or using a telephone instead of just an old school audio call. It's a great way to avoid going where sick people are. Mm-hmm. And that was true before COVID-19. Now they don't want you to go down to where the other sick people are, because you might get whatever might be out there, right? So telemedicine is a first line of defense. The way we deploy it and use it within our plans is to say, hey, we want you to have the most convenient means to have a primary care doctor visit possible for you. And the most convenient way for you to do that is to do it over a telephone call. Typically, it happens in 5 to 8 minutes. Everyone can rightly understand that in the current era we're in, with all the lockdowns and the concern and the fear even of COVID-19, that the wait times for telemedicine consults may be a little bit longer than typical. But typically, without pandemics being at bay, then those consults are happening in 3 to 5 minutes time. These doctors are board certified physicians. These are not nurse hotlines. These are doctors. They can prescribe medicines for you as appropriate. They haven't figured out a way. Apple hasn't how to do an ultrasound yet, or to look at your throat, right? With that may come someday, right, but it's not there yet. So those teledocs are really well versed and well schooled at knowing what their parameters are and when you need to be seen and to send you to see, to have a physical consult. Now, the part that's best about ours, there's no copays associated with these virtual telemedicines. There are insurance plans that are out there in the marketplace. You may even, as you recruit new agents, you may encounter some individuals who say, well, I'm on my spouse's plan, and you should ask them, do they have teledoc? And the reason you do that, because not every insurance policy in America that includes teledoc does so in the way we do. They don't always make it available for zero copay. Okay. That is our model. And if you've paid attention to Workplace recently, eXp and Clearwater has just launched a new teledoc only, a standalone telemedicine service. Guys, it is not a replacement for the plans we're talking about today. It is purely an add-on if you don't have a health plan, or rather if your health plan does not include telemedicine. It's a very affordable plan, but I don't want you to think that if I get telemedicine, this plan that's about $10 as a standalone product, that if I get that and then I get COVID, that I've got great care, because it's only for telemedicine. It's not for hospitalization. Right. All right. All of our plans, however, do include it as a baseline. Teledoc, we include preventative care. That's annual physicals for everyone in the family, as the ACA requirement would be for a preventative care component. Excuse me. So what that's going to include is physicals. It's going to include immunizations for children as appropriate, well child visits. It's going to include for women over the age 40, a mammogram, a screening mammogram, and then for all adults over age 50, colonoscopies. We have two kinds of plans, Jeff, that kind of deviate. You'll see no, yes, no, yes. That reference to no is for HSA compatible plans, health savings account compatible plans. Who are good fits for health savings account? Those people who like to be self-directive when it comes to their health care. They may say, I'm very healthy. My family is very healthy. We don't go to the doctor frequently other than for a physical. By the way, these preventative care exams are with no copays. So, but when you get down to this section where it says doctor copays, HSA plans don't have that model. You're paying full cash price, full freight. You're paying for it with health savings account dollars that you will have set aside in addition to your monthly cost for the plan. Okay, it's an additional component. You would have to fund it as you have available means. There are some agents who say, I don't want to fund any money in my health savings account. There are tax advantages. I won't go into it today. I will let you know that our new plan partner, our new third-party administrator, Planston, actually will administer a health savings account now for you. At least they have a relationship. So it's a seamless experience now when you sign up. If you're going down the health savings account path, one of the options will be to also sign up for Optimum Bank, okay, which is has a health savings account set up. You'll probably remember when we spoke in November, Jeff, that health savings accounts are your dollars. They're not someone else's. They roll over. If you don't use them, they accrue. And not only are they contributed tax-free, they become tax every earning, whether it's in the cash account or after some time when they've been when you've been able to let them accrue, you have them invested. Those accrue tax-free as well. And then way out there on the horizon at 65, they can be withdrawn without any taxes either. So it's a triple tax advantage. That's on the HSA plan. Then we have copay options, which are a little richer. Those copay option plans, both within Standard and Premier, are going to include a set number of doctor visits. And Jeff, what's changed since last fall is they've gotten there are more doctor visits included in our plan. So it's 5 primary care doctor visits, then the copay plan option per person per plan year with a $20 copay in network or $50 copay if you go out of network for primary care visits. Urgent care, you see this line, urgent care for the copay plans include 5 urgent care visits. Again, $50 copays in network, $100 copays out of network. And then specialist visits are also included, though they're not specifically delineated here, with a copay amount of $50 in network and $100 if you go out of network. So what's changed, Jeff, from last year is in the past, if you went out of network for these copay doctor visits, those were all on your side of the table to pay, the full amount. But the plan actually does pay a portion for these doctor visits. And our formulary has gotten better. The formulary is a drug list. When it comes to the formulary for maintenance medications, if you're taking something that is of a pre-existing kind of nature, I get a lot of agents that I speak to who have thyroid issues. They're on something simple, relatively simple to take. If they're on a thyroid medication or any kind of chronic medication that's costing them a lot of money, they should look at our copay options, because the formulary has a 3-tiered set of copay amounts for prescriptions: $10 for generics, $25 for brand name, and $50 for specialty drugs. So they're very affordable. When I talk to individual agents, when I have conversations with them, I kind of ask some diagnostic questions. You might remember me asking you those, Jeff, and I'm asking to try to get a sense of what's the best plan for your family. And if someone tells me, oh, we're really fit, really healthy, we're not on any medications, no pre-existing conditions, and I'm really most interested in the lowest cost offer and what can you do for me, then I'm taking them down the HSA track, either the Premier or the Standard. And the reason I do that is most of those people already understand what it means to pay cash for doctor visits. AHSA is just given the ability to use, pre-tax dollars to make those kind of doctor visits. I talk to other folks, especially those that are coming off of employer-sponsored plans, if they've made a job transition, right, from a different career into real estate, and they're used to having kind of, just one card, a seamless experience with doctor visits where they're just paying low copays, then I go down that path with them, the copay path, because it's going to mirror what they know to do. There's transferable skills in terms of using that plan, our plan, that will make them readily able to just pick up what they've had to what they would now have available to them.
Right.
Obviously, these plans are a little bit more costly, the copay options, because they include sets of benefits that some people just won't use. And if they raise that as a question, then I'll say, then let's look at the HSA option for you. Okay. Let me pause, take a breath, and see what questions you might want to ask based on what I've shared so far.
Well, does anybody watching now have any questions for Thad or myself?
I don't really have a lot of questions. I really haven't done a ton of research on health plans or anything like that, so I don't really have a lot of things that I would want to ask necessarily.
Okay.
One piece that is important, Jeff, this network is still from PHCS, but it's an improved network now. And what I mean by that is
it's a PHCS.
It's just simply PHCS is the name of a network of networks, truthfully, that was purchased. The company name is actually multiplan.com or phcs.com. But they went through, there was some market consolidation for networks several years ago. Multiplan purchased PHCS, and they purchased a lot of subnets afterwards. But our network has gotten better over time. In the months that I've been working or marketing, especially to eXp agents, I've really only found 3 who did not find their doctors in our network. Okay. And that was before the plan upgrades. So this is actually the broadest network that PHCS has. So we've gotten broader. Our plan options have gotten more in terms of the doctor visits, because it used to be 3 and 3. You'll remember that number. Now it's 5, 5, and 5. It also includes urgent care. Someone's coming in. Hi, Chance. So the new plan options include more doctor visits, as well as a better network and a better drug formulary.
Okay. That makes a lot of sense there, especially with the, on the PHCS, as you mentioned there. That I know is a big question for folks is, hey, if I'm on a particular plan with my employer, I'm moving into real estate, I'm only going to start part-time. Am I eligible for insurance? How does that look for me? Obviously a good seamless transition to move over and to, adopt these new plans.
And we love, I love having those kind of conversations with people that are making career changes, because, it's something I've done. This is kind of the 3rd career I've been in. Always been in helping roles, right? I've always loved to be in a helping role, but people, when they make job changes, don't always understand what it's like to be an independent contractor. And one other thing, Jeff, that's really encouraging and awesome about this specific plan, or all of our plans rather, from Clearwater, at least during the ones that we're representing today, there is no enrollment period. So we're always open. One other change, Jeff, that's really significant, I'm saying this for Wesley, who's here today also, is, when we spoke back in November, Jeff, you had to be enrolled by the 20th in order to start by the 1st. Now we can take you through the 31st, or the last day of the calendar month, to start tomorrow. And in fact, if you enroll through the 15th of a month, it will backdate to the 1st of the month. However, what changes is, if you enroll after the 15th of the month, you're pushed to the following the following month's first day, so that you're always starting on the 1st. Okay. And the other big change that's happened, Jeff, since earlier on, is that we now can take not just bank drafts, ACH transfers, but we can also take debit cards or credit cards.
Okay.
All right, so let's look at, I'll share this document with you. Absolutely want to give it to you. I've kind of addressed it already. Preventative care, virtual primary care, how those prices work out depending on which swim lane you go down, HSA or copay. But let's talk a little bit about the deductible part. You talked about the sharing aspect. Our plans are an innovative combination of a traditional insurance product. That's those copay and even the HSA aspect. There's a traditional, it's called a fixed indemnity or limited benefit health medical plan that's included for that part of the plan design. But when you get to major medical costs, that's where innovation happens the best and where costs are retained and held lower for you as an independent and as an eXp agent. And that is through the use of what's called medical cost sharing.
That's what I wanted you to get into, medical cost sharing.
Absolutely. Medical cost sharing is not a new industry. It's a 30-year-old industry. It is to health plans what Uber and Lyft have been to the personal transportation system. And I don't know about what part of the world you live in, but even more than Uber and Lyft, those are four-wheeled vehicles, aren't they? But then when you get in some cities, Austin and other large cities, but not San Francisco, interestingly, you'll find those personal scooters from Bird and Lime, right? And so it's been pushed to an even more extreme, even more personal. Medical cost sharing is simply a disruptive approach to say that we can pay for medical care in a lot of different ways in the United States. You made a reference a moment ago to some agents who choose to not have insurance. Some make that choice, okay? And when they do so, they understand that there are different ways to handle the cost of medical care in the U.S., and having insurance is just one of those. Medical cost sharing is a collaborative approach to addressing large healthcare costs, and it works a little bit different than the traditional insurance model. And it's addressed on the screen now where the question is asked, what's the overall deductible? Truthfully, in medical cost sharing, we don't work with that terminology. We work with the terminology of, at least in this specific version, called an initial unshareable amount. That's unchanged, Jeff. The terminology is common from what we talked about last year. What's different now is the company that's behind this. The medical cost sharing provider now is a company called Zion instead of Sedera, Zion Health. Zion is not new. It didn't just get launched. And what is very interesting about this is it actually helps you as an individual in any state in America to be exempted from the individual mandate penalties. You may or may not be aware that at the federal level, the individual penalties were taken away beginning with the last tax year, 2019. But there are some states in the union that do require you to have individual insurance, or they're going to charge you. Zion Health qualifies, or rather exempts you from those penalties. So does our copay or HSA plan. So you're actually doubly exempted. Let's talk about, though, this initial unshareable amount. And you may notice a difference, Jeff. It used to be that we had $1,500, $2,500, and $5,000 levels. Now we have three, $1,000, $2,500, and $5,000 levels. And let's talk a little bit about initial unshareable amounts. A deductible, which this is not, but in traditional insurance with deductibles, they will reset at the end of a calendar year.
Right.
And at the end of that calendar year, even if you're in the middle of a significant health event where you're spending a lot of dollars, or someone is, if you have not met your deductible at the beginning of receiving that care. Let's use as an example my go-to story of my brother-in-law, who back 12 years ago was on a high deductible plan, independent contractor, though he's an electrician. Our two families were on a vacation over Christmas and New Year's in southern New Mexico with way too many Texans and way too little snow at the southernmost ski area and in the U.S. And we're there, and on New Year's Eve, my brother-in-law, who was 37 at the time, started having really bad chest pains. He was very fit. He gets taken to an ER by his wife and my wife. They're sisters. They rush him over there. Pretty quickly, they do tests. It's New Year's Eve. They do tests to rule out the heart attack. So that was some good news, but he's in great pain. They do further scans, and they discover that what he's having is a gallbladder attack. And it's literally 4 hours before the end of the calendar year, and he has not paid a dime towards his high deductible plan. But that ER trip cost $12,000. He got to pay $10,000 of it because he had a high deductible plan, and he had not paid a penny. He was healthy. He was fit. He was in great shape. He hadn't paid a dime towards his deductible, but he paid 10 grand in the last 4 hours. However, he gets sent home, and then when we get back to Texas in 2.5 weeks later, he has to have his gallbladder taken out. It's a new year. It's a new deductible, another $10,000. Ouch. On these plans where you see what I'm speaking about here, that would have been a single medical event from beginning to end. The calendar would have been irrelevant, okay, for that medical event. And if he had dialed in at a $1,000 level plan, then he would not have had to pay $10,000 or $20,000. He would have paid $1,000 total for the event. Now, you can choose in any of these dollar values, and they're defining for you the event amount and the rough amount for your out-of-pocket maximum. I say rough because with our new partner, Zion Health, you have maximum annual number of these events that are on your side of the table at 3, okay? So if you're on the 1,000 level, your max out-of-pocket is roughly for your family $3,000. That's different, Jeff, than what we had before, because it was 3 for an individual or 5 for the family. Now it's 3 for the household. Okay.
No.
But if you have a 4th or more events, well, you had a bad health year, obviously. But the threshold amount drops down then to $500. So when I said it's the max out of pocket, if you're on the 1,000 level, is $3,000-ish. That's because if you went to a 4th event and it went over $500, it can be shared through the community. Okay. So all of these are community driven, but what's different, Jeff, and what's even better now is that it's a single seamless experience because it's administered by Planston. So from your perspective, you're still just showing the same card that you have if you have an HSA plan or copay plan when you have to be taken to an ER or when you have to have a surgery or get hospitalized for something. You're just showing them that card. And all of the paperwork gets administered digitally, electronically, and administered by the third-party administrator, Planston. And you don't have anything else to do except to pay your initial unshareable amount. That's your portion to pay. It's kind of a you pay first portion. So anything that I've said so far, I mean, in this screen that you guys want to ask about?
No, this is a great screen because I know people are going to ask, well, you know, what's covered? Those are the big questions. What's covered? What's the deductible? Because people know they're going to need to fill that. Also, that bridge period, I'll call it for lack of a better term, with a single event carrying over, that's huge because we've had personal experience with that in our home with things that happen towards the end of the year. We're paying towards this deductible. And then all of a sudden the new year starts and our deductible's starting over, but we're still dealing with the same issues.
You're having to push it up the mountain again.
Right.
It's even more advantageous when you look at a couple of other points. With dire diagnoses, like a cancer, dire diagnoses like cancers go multiple years all the time. In this model, our model, that's a single event until you're 12 months treatment or symptom free. Wow. And it's not going to hammer you if you have a dire diagnosis and you can't work. It's not, and can't pay that deductible because you're sicker than you may have ever been. You're not going to be hammered with having to pay that again. And then the second thing that is of advantage, a great advantage, is that even with this part and with Zion, there's still no penalties if you go out of network. I just read an article in the New York Times this morning. That was a story about someone in the current event of COVID. He had not been feeling well. This was back early part of March, and there weren't many tests going around at that time, right, available. But his symptoms weren't good, and they weren't getting better. And he called his doctor, and the doctor said, well, I don't think there's any issue. but just keep monitoring, stay confined in your own home. And then after he hung up, about 10 minutes later, the doctor called back and said, you need to go down to the ER and get tested today. And it was an hour drive, but he got there. And what has come about since then is it turns out the ER docs that treated him for the COVID testing were not in his insurance plan, because many emergency room doctors in the US are not on anyone's insurance plan. So our plans don't deal that way. This guy who's suffering, I think he's probably recovering now from COVID, thankfully, but he is having to pay those costs when he thought he was doing something well. Now, I'm not making any kind of statement about whether that in this event that should or shouldn't have happened, but I am saying that every person that's on an a traditional insurance policy in the U.S. today should always be aware of going out of network, and many hospitals employ out of network physicians to work in their hospital. So our plan, on the other hand, doesn't ever present you with that conundrum. You're never going to be hit with a surprise bill, because even in or out of network, it doesn't matter. It's still going to be shared through the community, and your IUA is the same, whatever you've bought in for.
Awesome. Awesome. So if somebody wanted to get started or to get more information, we'll go ahead and I'll go ahead and share the slides with folks, but what can they do to get started, to get more information, to become more educated on exactly how these plans work and how they compare to their current plans?
Yeah. What I would dearly love to do is to become you and your team and anyone that sees this, your personal agent at Clearwater.
Oh, wow.
And
all right.
Contact me. I'll send you my a shortened, I'll use a bit.ly for my Calendly link, okay, to set a time that's appropriate and convenient for anyone that's on your team or may be joining your team. I'll be happy to speak with them, and it will take about 30 minutes. We'll walk through it, and I'll certainly present this information. Actually, I don't usually use this as a summary of all of the plans, Jeff. It felt like it was more appropriate for where we're at. But what I typically will do is start with the copay standard 2,500. Let me quickly mention that the premier levels, why are those of advantage to you as an independent contractor? One of the biggest things that hits you as an independent contractor is lost income because of inability to work. If you get sick or injured, hospitalized, or have a dire diagnosis and you can't work, who's helping you pay for anything? And our premier level plans will include supplementals. They're not required. They're totally optional, but they're added into that level of plan with guaranteed issue if you go in the lowest dollar values. Guaranteed issue means that no one has to underwrite them. There's no physical, there's very little health questions that get asked for those guaranteed issue. They would provide an additional cash payment lump sum in addition to the medical payments that are going to be made to providers on your behalf. Those premier level plans will come to you to help offset lost income for any purpose that you may want to use those cash payouts for.
That's awesome.
So that was a freebie. I want to be your team's go-to guy. My contact information is going to be available. And if I'd have been smart, I would have put it as the last screen, but I didn't.
That's okay.
I'll make sure that's who I am.
Yeah, I'll put it in the notes down below. This will also be, if you're watching it on YouTube, all of the information to get a hold of Thad and his calendar is going to be down in the description below. We'll make sure that we get that out as well. Thad, thank you so much for taking time out of your morning and in your home, of course, as we all are, to share with us just these great benefits, these great plans. And yeah, I wish you the best. Anything else you want to share before we go?
I just, we are, Clearwater is here for you guys at this time, but we'll be here when the current crisis is gone, and we'll still be available to you to help you guys to understand health plans, because they are confusing. We want to be your consultant that makes a difference for you. Thanks so much.
All right. Thanks for being here, Thad. Appreciate it. We'll be in touch.
Thanks, Thad.
Take
Thanks,
care.
guys.